Have you ever walked into the kitchen only to forget why you were there? Or seen a familiar face but couldn't recall their name? Most of us brush it off as a normal part of aging, but what if that might not be the case? I'm a doctor with over 20 years of experience, and today, I want to share a concerning truth that few are warned about. Some medications you may be taking daily, seemingly harmless, could be silently harming your brain. Even more alarming, they may be increasing your risk of cognitive decline or even Alzheimer's disease. This isn't an attack on modern medicine. I believe in it. I live it every day. But that's exactly why I know. Knowledge and proactive care can change lives. Today, I'll walk you through 8 common medications, ones you or your loved ones may be using, that have been linked to memory loss. Most importantly, I'll also show you how to protect your brain so you don't pay a heavy price in the future. Omeprazole, stomach relief, but at what cost to the brain? Omeprazole belongs to a group of drugs called proton pump inhibitors, PPIs, commonly used to treat acid reflux, ulcers, and heartburn. It works by reducing stomach acid. But did you know that long-term use of omeprazole may negatively affect your brain? Studies show that about 10% of people using omeprazole for 3 years exhibit signs of memory loss. That number rises to 33% after 4.5 years. Why omeprazole impairs vitamin B12 absorption, a crucial nutrient for nerve and brain function. It also disrupts gut microbiota, which plays a major role in brain health through the gut-brain axis. Solution: if you've been using omeprazole long-term, consult your doctor. Lifestyle changes, dietary adjustments, and stress reduction may offer alternatives. Never stop this medication abruptly without professional guidance. Anticholinergics, allergy, depression, and incontinence meds with a hidden risk. Anticholinergics block acetylcholine, a neurotransmitter essential for memory and learning. Some common examples include diphenhydramine, for allergies and colds, amitriptyline, an antidepressant, oxybutynin, used for urinary incontinence. Prolonged use of these medications may increase the risk of dementia by up to 54%, especially in older adults. Solution: reevaluate your medicine cabinet. If you're on long-term anticholinergics, speak with your doctor about safer alternatives, like newer generation drugs with fewer brain-related side effects. Corticosteroids, anti-inflammatories that can cloud the mind. Medications like prednisolone and dexamethasone are widely used to treat asthma, arthritis, and autoimmune conditions. But long-term use can lead to anxiety and depression, confusion and disorientation, memory loss. Corticosteroids are synthetic forms of cortisol, a stress hormone. Excess levels over time may damage the hippocampus, the brain's memory center. Solution: always follow your doctor's dosage instructions. If you need long-term corticosteroids, ask about minimizing the dose or switching to less harmful alternatives. Benzodiazepines, tranquilizers, that quiet the body but hinder the mind. Often prescribed for anxiety and insomnia, benzodiazepines include drugs like alprazolam, diazepam, and lorazepam. While effective for short-term relief, long-term use is another story. Research indicates that chronic use may double the risk of Alzheimer's. Symptoms include memory problems, difficulty concentrating, and confusion. Why benzodiazepines affect key neurotransmitters involved in memory formation and also disrupt deep sleep, the stage when your brain consolidates memories. Solution: if you've been taking these drugs long-term, talk to your doctor about tapering down or switching to non-drug therapies, such as cognitive behavioral therapy, CBT, which treats root causes without affecting memory. Amphetamines, focus boosters that may burn out the brain. Prescribed for ADHD, amphetamines, like Adderall and Ritalin, improve attention and control impulsivity. But long-term use or misuse can be dangerous. It may lead to memory loss, reduced motivation, and even permanent neurological damage. These drugs flood the brain with dopamine and norepinephrine. Over time, this constant stimulation can exhaust the brain and disrupt natural function. Solution: use only under close medical supervision. Combine with behavioral therapy, physical activity, and nutrition to minimize dependency and improve outcomes. First-generation antihistamines, allergy relief that may dull mental clarity. Medications like chlorpheniramine and diphenhydramine are common for allergies and colds. But long-term use, especially in older adults, is linked to a higher risk of cognitive decline. They have strong anticholinergic effects, reducing acetylcholine and thereby impairing memory and learning. Solution: consider second-generation antihistamines like loratadine or cetirizine. They're safer for the brain and just as effective. Tricyclic antidepressants, mood stabilizers that may cloud thinking. Used for depression and chronic pain, medications like amitriptyline and nortriptyline can impair cognitive function. They block acetylcholine, leading to weaker information processing and memory storage. Older adults are particularly vulnerable to these side effects. Solution: talk to your doctor about switching to SSRIs, like fluoxetine, which regulate mood without significantly impairing cognitive function. Statins, heart protectors that might affect brain performance. Statins, e.g. atorvastatin, simvastatin, are widely prescribed to lower cholesterol and prevent heart disease. However, some users report memory lapses and confusion. Cholesterol is essential for brain function, especially in building neural connections. Lowering it too much may impact cognition. Solution: if you experience memory issues while on statins, speak to your doctor. Adjusting the dose or switching medications alongside lifestyle changes may help. Conclusion: be the guardian of your brain health. Medications can be life-saving, but they can also silently erode brain health if misused or taken long-term without monitoring. Understanding the pros and cons of each drug, especially as you age or if you have neurological concerns, is critical. Always communicate openly with your healthcare provider before starting or stopping any medication. Remember, cognitive decline isn't an inevitable part of aging. With informed choices, a healthy lifestyle, and proactive care, we can keep our minds sharp and vibrant. Thank you for watching. If you found this helpful, don't forget to share it with your loved ones. Let's spread awareness and keep each other healthy.